Hey there, friends. I'm actually recording this on my laptop and not on my phone, because I'm waiting on the surgery center to call me to finalize when my actual surgery is. My surgery is tomorrow, but they call you the day before to tell you what time. It's because I'm not going to directly to the hospital. I'm going to a actual surgical suite where they only do about two surgeries a day there, and so you kind of get like more, um, I guess, intense care. Like that nurse is only your nurse. That tech is only your tech. That doc is only doing those two surgeries a day. And I opted for that for a couple of reasons. Going downtown could be a little bananas in terms of parking. I didn't want to stress myself that way. This place has like a big parking garage, like a big other, and then they sort of wheel you out into this area where you don't have to like compete with other people, do things. I'm so stressed. I feel like I can't get everything done that I want to get done because, like, for 6 weeks, I'm not going to be able to do a lot of things around the house. And if anyone knows my relationship with my wife, which is perfectly fine, but I'm very much the lady of the house. I'm very much the one that sort of, and not that she doesn't clean or cook or anything like that. I do 95% of it, and she helps. She's been helping, sort of just take care of the floors and things like that because I haven't been able to, with my leg. And I spoke to my psychiatrist last week because I needed to do a med check. I've been trying to make sure that I get everything sort of situated. I've never shied away from telling people that I have CPTSD. I've never shied away from the fact that I have anxiety and you know um, panic attacks and things like that. Like, I'm not going to be that person that pretends that everything's okay. It's definitely not. So I spoke to my psychiatrist, just to do a med check because I didn't want to have to do that while I'm sort of recuperating. And she said, listen, I know you don't really take your spot treatments. I have Klonopin as a spot treatment. She's like, I know you don't really take that much. And I don't. Um, and she told me, this is the week to do that. This is the week to do not allow yourself to get sort of amped up, and you already have enough going on. And I don't know. I've done a lot of research, and I've done, seen a lot of sort of interviews with people who've had the surgery, and they've all said they've had like immediate relief, and that's great. It's just getting to the point of the surgery of all these other stressors. And um, I had some pretty sort of, when I was younger, I had a lot of medical problems. I mean, I still do. I still have a lot of medical problems, but when I was young, I had, like seizures and things like that. And I had to go through like a lot of medical procedures. By the time I was like 4 or 5, I had already had like 4 spinal taps as a child, which is terribly traumatic. I had a hernia operation right before I was 4, and I have some pretty intense sort of memories from that, which is hard when you have memories that are sort of from from childhood where you're not. your brain isn't really structured to sort of compartmentalize where these things are going, and a lot of times when I have a surgery, that's the thing I take with me is sort of intense fear, even though I'm 43 years old and I know it's not the same. It's hard to just say everything's going to be okay. And I get why people say that. People are uncomfortable with being uncomfortable, but like I'm always uncomfortable. So I have my surgery tomorrow. It's either going to be at 5 o'clock in the morning or it's going to be at 11 a.m. I have to 2 hours before my surgery. I have to drink this carb drink, which I forgot to bring in here because I don't want it to be like something I forget. So it's on the kitchen table. So if I have surgery at 5 a.m., I have to set an alarm for 3 a.m., chug down this bottle of carb protein, whatever they gave me, go back to sleep. Maybe, probably not if it's 3 a.m. Then, like, I have to take the other bottle with me, and I have to take it like 5 minutes before surgery. I have to take a shower tonight, and then I have to use these. I believe it's actually chlorhexidine, which is something they use usually in dental, which means it'll probably be sticky and weird. Um, and I lost my train of thought. I'm just so tired. I'm so stressed that I can't focus on like these things, like I can get up and I can do things around the house and that helps me feel better and it helps me get through the day. So that's what I've been doing. But also, I know that also causes me like a bunch of stress. Anyway, the chlorhexidine wipes, and then I have to do that the night before. And Danny just changed, my wife just changed the sheets and sanitized the bed, with a spray and sanitize the sheets because they don't want you to have like any weird bacteria on you. I mean, I do have to say this is probably the most intense thing I've sort of gone through in terms of getting ready for a surgery. It was a bit of a frustrating thing. They had called in all my post-op surgery meds, and they had called it into a pharmacy that I literally have only used once since we moved here. And when I realized the pharmacy was like way too expensive, we stopped using it. And literally one time that I had, and somehow it's still listed on my chart, even though I have two other pharmacies, and I have a pharmacy that's literally, like a little mom and pop pharmacy that I go to that I can walk to downtown. And so I had to go through the process of emailing people and waiting on the email, and just it was just it's there's always a thing either way. So they send in all these meds, so it's like my opioids and like my baby aspirin and like some other anti blood clotting thing. And then, of course, because I'm going to be on opioids, um, you know, Colace and Miralax, you know, so I can poop. I'm hoping that this thing that I've heard where people say they instantly feel better, even though they have like a massive sort of incision and they've had to move muscles and tendons and do their thing out of the way, and even though that's going to be physically painful, I'm hoping that I have this like great feeling of, oh my God, I feel better. Because I think that I have been so bogged down with pain for so long. I wish I could describe to you the pain that I'm in. And there's only been a few people who have actually seen me sort of get up and walk around. And I recently had a trip to Chicago for work, and a bunch of my coworkers had to see me sort of walk around with a cane and me trying to get in and out of cabs. Um, and while that's awkward and weird, um, it's painful. I don't know. Well, tomorrow is the surgery, and I do have a bunch of videos set up to edit to keep myself busy. Once I sort of get home, I'm giving myself a full sort of 5 days of just getting used to taking pain meds and I guess pooping or whatever it is I won't be able to do, and doing the exercises that they've told me to do. And I will try to give an update soon after that. Take care, guys.